All right, Bridget, are we ready to roll here? I see. Thank you, Jay. So Jay, it's very interesting to watch you interpret from afar. All right, we're going to get started. Good morning, everyone. Thanks, as always, to Jay and Danielle for interpreting this morning. So as you can see, I'm remote. Greg, though, is on site with Jay in the background. So we're going to kick it to Greg pretty quickly here this morning. But I'm going to review the numbers as we always do. So the total number of positive cases in Hamilton County is 6,158. The difference between last week and this week is 1,148. So that is a significant increase in positive tests in Hamilton County. Hospitalizations are now at 747. The increase since last week is 44. And the death count is 204, and the increase there is 6. So to give you an idea here of, because I know it's hard to keep track of these numbers as we go week to week, but we are trending significantly up as we have been with positive cases. We are also seeing that trend line with hospitalizations go up. That is the more troubling of those two numbers. And then the death rate is a lagging indicator. So still relatively flat, but we're concerned that that is going to increase, obviously. So we are continuing to trend in the wrong direction. These numbers should give us pause and make us reflect on what we are doing individually to reduce the spread of COVID-19 in Hamilton County. I applaud Governor DeWine's order to require masks. Masking up keeps our loved ones safe and our businesses open. We have been working with the governor in recent days on an approach that is streamlined and consistent throughout Hamilton County. Remember, there are 49 jurisdictions in Hamilton County, all of whom are concerned about this and wondering how they should approach the mask situation. The decision to mandate masks is driven by the numbers and by the advice of public health experts. We have been told that if 4 of 5 of us wore masks, we would see a dramatic reduction in the spread of COVID-19. Mask wearing is one of the ways we can get on with our daily lives while continuing to reduce the spread. And so I have received many emails and phone calls regarding this situation, almost all of which were people wondering why Hamilton County hadn't required masks yet, interestingly. And we had to convey to them that the county commissioners do not have the authority to do that. And that county health commissioner, Greg Kesterman, only has that authority if he is given that authority by the state health commissioner. And so what we saw yesterday was Governor DeWine say he is going to, and he did, mandate masks in the counties that are red on the map. So there are a number of indicators that make you red. And so as long as we are in that category, the mask mandate will be on Hamilton County. And so I'm going to let Greg elaborate on how that plays out, who is tasked with the enforcement and what we anticipate in Hamilton County. But one last thing, so we've already seen some social media around the idea of reminding people that you have to wear a mask under certain circumstances, and Greg will get into that. But if we could flash up the one that P&G has put up, I think it kind of captures the essence of what we're trying to do here, because it reminds us that we need to get on with our daily lives. There is something we can do here to allow for that, and it's putting a mask on. When you're in a public place near one another, when you're out in public and you can't safely distance, put a mask on. It helps us get back to our regular activities and to the things that we in Cincinnati and in Hamilton County have been accustomed to enjoying, especially in the summer months, like going to Findlay Market or going to a street festival or going down to a ball game, or all the things that we love to do. We're desperate to get back to some of these things. And one of the ways to do that is to wear a mask. So I don't know if the graphic went up. I didn't see it, but it's really cool. And so hopefully we'll get it up at some point during this briefing. So with that, Greg, I'm going to kick it over to you so that you can expound upon what happened yesterday in the governor's mandate.
Thank you, Commissioner. I appreciate you holding these weekly briefings. These have been a great opportunity to get information out to our communities and make sure people know what's going on. Obviously, a lot of change lately. COVID-19 is with us, obviously, for the long haul, and it's important that we continue to share this data to make sure that everyone is up to date as possible on this ever-changing situation. I always like to follow up Commissioner Dreihaus's numbers with some of our recovery numbers here in Hamilton County. Here in Hamilton County, in our jurisdiction, outside of the city of Cincinnati, Norwood, and Springdale, we are up to 3,274 cases, of which we know that 1,033 have recovered. In addition, over the last few weeks, we continue to see cases rise in Southwest Ohio as well as Hamilton County. It's not surprising that we're finding more cases as we are actually out there doing more testing. However, it does not account for all of the increases in these cases. We continue through our contact tracing work to see some community spread cases, actually quite a bit of community spread. This is when people don't know where they're getting their COVID-19 from, just from their normal lives. I want to take a few minutes to discuss some of the data. I've been sharing the reproductive value weekly on this press conference. The reproductive number is starting to come back down to a more acceptable number. For those of you that have been following along, a reproductive number greater than 1 means the outbreak is expanding exponentially, and when it starts to fall below 1, we start to see a decrease in the number of cases. Today, the reproductive number for Hamilton County was 1.07. For reference, last week on Wednesday, the R value was 1.12, and 2 weeks ago, 1.45. So that is one value that we are watching closely, and that is definitely a positive value, and I'm happy to see that happening. I think it's also important to realize, though, as Commissioner Dreihaus shares routinely, and I do as well, that we're also looking at hospital admissions. There are now 175 approximately hospital administrations. At the peak in late April, we were at 150. So that's not a good indicator. That indicator does not rely on test data. That indicator is independent and does not account for how many tests are being conducted. So that is definitely in the wrong direction. Similarly, in mid-June, we were at 15 intensive care unit admissions. Now we're at about 55. For reference, our last peak was in April. We were at 75. So we're not yet back to where we were during the height of our cases here in Hamilton County, but we are absolutely trending in the wrong direction, which makes it even more important that we start to change things up. I have one more slide showing data related to the case counts here in Hamilton County. This graphic is available on our homepage at hcph.org. This shows the number of cases per day countywide, and it also has a 7-day trend line on there to help kind of smooth things out and make it easier to see how we're trending over time. To this, for a point of reference, about 3-4 weeks ago, we were on average seeing between 20 and 30 new cases within my jurisdiction per day. So as things kind of progressed over the last couple weeks, we have shifted. Now we're seeing between 70 and 100 cases per day, a significant increase in work. Oftentimes on these press briefings, I get questions about contact tracing, so I just wanted to indicate our plan is working. We brought a bunch of my staff back in to help handle this new caseload. And then as time progressed, over the last week, we've hired 12 additional caseworkers that will be doing this contact tracing. In addition, we've got another 4 or 5 that we're looking at to bring on late this week and early next week. This is extra capacity, and we're doing so to make sure that we can continue to handle the volume. I want to move on to testing, and as we've reported during last week's press conference, we are doing some pop-up testing with the Ohio National Guard. The governor indicated he would send the guard down, and he brought 22 guards, men and women, who are just doing a phenomenal job in our communities. Last week we were in Forest Park. We tested over 3,600 individuals within the community. This week, yesterday, we were in 2 days ago on Monday, we were in North College Hill, yesterday in Delhi Township, and today in Coleraine Township. By the time we're all said and done, we anticipate that we will have tested over 6,000 individuals. All of this testing has certainly put a burden on our laboratory, and so results are slowly coming back. And as soon as we get them, a representative from Hamilton County Public Health is making a call to make sure that you know how your test fared. In addition, if you're positive, that contact tracing work that we talked about will initially begin, and we will start making those calls. All test sites, including the GARD test sites, can be found on our website, hcph.org. I know I've heard some individuals say they don't have time to wait for a couple hours to get the free testing from the Ohio National Guard. That said, there are a bunch of other sites that require no doctor's note, and you can use your insurance and you can get that test done, oftentimes with no copay and oftentimes free with insurance. So please take advantage of those. There are other GARD sites listed on our website too that require the show of insurance if you have it, but if you check the box no insurance, you can get tested completely at no cost. The governor this week, as Commissioner Dreihaus just indicated, rolled out his public advisory system. This is a 4-tier system, kind of showing the increase in risk within our communities. Here in Hamilton County, we are a red level or a level 3, which means very high exposure spread, limit activities as much as possible, and follow all current health orders. So we're really just bringing about the importance of awareness with COVID-19 in our community. When we become an orange or a yellow, it doesn't mean that we're safe and we're out of the woods. It just means that there's less community spread and that we still need to be vigilant to prevent these cases from rising. And that's obviously one of our goals. The message for all of these categories is basically the same, and it's what I've been talking about since February. Stay home when you're sick. Even if you just had a negative test result for COVID-19, we're asking you to stay home when you're sick. We want you to physically distance from others that aren't part of your household. We want you now, and I'll talk more about this in a moment, we want you now when you're in public places, particularly indoors, to wear masks. Hand sanitizer when you don't have access to hand sinks for hand washing. Cover your coughs and sneezes, and don't touch your face. These are the way that we spread infectious disease, and this has been public health knowledge for centuries. This is how we slow the spread of COVID-19. So as we heard yesterday, Hamilton County is a risk level 3 or red. Counties with this designation are considered very high exposure for the spread of COVID-19. And therefore, he is mandating masks in any county, including Hamilton County, in which is currently at a red level. It's not a surprise that public health is very much in favor of masks. They have been scientifically shown to help spread infectious disease. So this is nothing new. This is what we've been talking about. We know that wearing masks, not only during times of increased exposure and spread, but at all times until we get a vaccine or a treatment for COVID-19 is going to be necessary. So while it's mandated now that we wear masks in Hamilton County, if we're successful and we do a great job and we shift back down to orange or to yellow, it isn't an indication that we should stop wearing our masks, quit social distancing, and quit all of those precautions that we've been talking about. It's just an indication that we're doing better. So we know, similar to how we worked with our businesses during the initial shutdowns, this is going to be a complaint-driven process here in Hamilton County, and our team will respond when necessary. We're going to work with our 45 communities that we're responsible for. Commissioner Dreihaus referenced 49 communities. As you know, we have multiple health departments in Hamilton County. So we're going to work with the 45 within Hamilton County Public Health's jurisdiction to work through this process. We know we will not have 100% compliance, just like a seatbelt law doesn't have 100% compliance. The goal with this masking mandate is to get people to care about one another, to help our community stop the spread of COVID-19 and protect the lives of those in Hamilton County. So we will continue to work with our communities to bring education and to help gain compliance. Throughout this pandemic, my office and our agency, and quite frankly, the county, has been working with businesses to gain compliance. Our process has always been about education. My team has reached out to several large businesses here in town, and many of those businesses are already planning on putting up their own signs and requiring anyone entering their business to put on a mask, and they plan to enforce it within their businesses. So I think this partnership is extremely important as we move forward. Once again, this is not about trying to catch people doing the wrong thing. This is about us as a community coming together and working like a team to reduce the cases of COVID-19 within Hamilton County. We want to reduce our alert status, and we're going to get there by coming together as a team. Masking is designed to reduce the spread and to save lives, as I've already mentioned. As we continue to open up more, it's more important than ever to respect the people who are working to serve us in these businesses and in these restaurants, as well as each other. Wear a mask, stay home if you're sick, and treat workers like the heroes they are for putting themselves at risk while they help us while we're out doing our business. Most of all, I always like to end with a reminder to be kind. This is difficult for all of us, and I want everyone to work together. Thank you.
Really important information. So let's go ahead and go to questions.
Got Jenna Cisneros with Channel 12 is up first for you, Greg.
Hey, good morning. Quick question for you. Do you think that law enforcement should be enforcing this mask ordinance?
I truly believe that this is not about us as government or police officers running around trying to catch people. I really believe that this is about us as individuals taking personal responsibility and following the new Director of Health's order to help stop the spread of COVID-19. I believe public health will have a role, and I believe our local communities, including police, will have a role. But it's really about partnerships to help save lives here in Hamilton County.
You. Josh Bazan with WCPO has two questions for you, Greg.
Okay.
Hi, Greg. Good morning.
Hi.
First question, I know this is something we've been talking about, something everyone's really looking at. Do we have any indication that the increase in cases we're seeing is because of increased availability of testing, or if it's linked, do we know if it's linked to just more people being sick every day?
So every indication I have is that it's probably both. We know as we test more and we have access to test people that we didn't have access to test previously, we will find more cases. But through the work of my contact tracers and some of the stories and some of the things I'm hearing, and the inability to link these cases back to others with COVID-19, that's an indication that it's community spread and that we are seeing cases as a result of it just being around within the community.
Yeah. And then the second question, do you guys plan to bring on any additional employees to handle these complaints that you might be getting from folks in the community, from businesses about the mask mandate? Are more people necessary?
So we are continuing to assess and understand what kind of volume we will see. I really do want to partner with the 45 communities that we serve. In addition, the governor and director of health have not yet released the actual order. So I don't know all the specifics and what sections of code we will be utilizing for enforcement. So I think I need to see some of that and then work with our prosecutor's office before we can make some of those decisions.
Thank you.
Fisher with Fox 19 is next for you, Greg.
Hi, Greg. Yeah, so my question again is about enforcement, which we've kind of been touching on, but what does enforcement look like? Is this kind of the county kind of going down and utilizing the local health departments to enforce this mask order, or is this the county kind of sending people out into the community, responding to calls? And what does that enforcement look like? Is this even enforceable?
I think it's really important to realize when the governor rolled this out a couple days ago, he didn't call this a mask enforcement mandate. He called this a mandate to wear masks. The word enforcement really is just one piece of the entire puzzle for getting compliance here. My office, whether we're out doing restaurant inspections, sewage system inspections, swimming pool inspections, we have always been about education over enforcement. When this pandemic first hit and we started going out to businesses and working with them to understand what was required under the shutdown orders, we were all about education. This has never been about taking individuals' livelihood away. This has never been about our office coming down with a big stick and trying to catch people. Our goal is to work with individuals to help them understand what is required to get through this pandemic. We're going to continue this work, and it's quite frankly very tireless work. My team is working very hard. I'm very proud of the 100 individuals that work at Hamilton County Public Health. People who are answering the phones doing birth and death records are getting constant phone calls about COVID-19 related issues. We are all shifting our roles, and we will continue to do so to make sure that we're responsive to customer complaints and concerns. But this is really, in my mind, more about individuals living up to what is required to help Hamilton County. I mentioned it, but no differently, I know individuals today that don't wear seatbelts. Wearing seatbelts saves lives. If we are choosing to wear a mask, we will save lives. There are going to be individuals here in Hamilton County and elsewhere that won't wear a mask, and they will refuse to. And it's about working to help educate and to make that make mask wearing the new normal. Those individuals that are not wearing masks, we need to look at that as not okay.
So when you guys do go out into the community, does that mean that you will go with a stash of masks with whoever is going out into the community, so that when you do educate people who aren't wearing masks, you can say, hey, here's a mask and you can put it on?
Absolutely. In fact, on my door at our office, we now have a big sign up that says masks are required. Obviously, as a health department, we want to lead that charge. Anyone who doesn't have a mask, we're giving them a mask. This, like I keep saying, this is not about trying to catch people doing the wrong thing. It's about helping them do the right thing and shifting the model so that we're more successful at stopping COVID-19.
Okay, thank you very much. We have Hannah Sparling from the Inquirer up next.
This question is for Greg. It's kind of following up on that question, but when you do have people, like you said, that won't comply, is there ultimately a process where you guys will issue a citation? And then a second question, how can someone make a complaint if they see people not wearing masks?
So our website is one tool for making a complaint. Our website is hcph.org. I have not yet seen the order from the Director of Health. Previous orders did not give health districts the opportunity to write a citation. As we know, within the city of Cincinnati, they passed a law, which cities can make their own laws, and they authorized their health department to carry around a citation book and to issue tickets, essentially. We don't have that authority unless it's expressly given to us within the director's order, and so I'll be watching very closely. That order goes into effect today at 6 p.m., and we'll have to look at that with our prosecutor once it does become available.
Okay, thank you.
Now, earlier, John London did have a question from News 5. John, do you still have a question?
I do. It's kind of a two-part question, Greg. There appears to be, from my traveling in the community, sort of a rural-urban split about the requirement. And I'm wondering if there are any proactive steps you can point to convince skeptics about it. And then I also wonder about your read on how close we might be to having a state order to stay home again and only go to essential business.
So with regards to compliance and different demographics or different parts of the county having more compliance or not, I think with each step of this pandemic, we see greater compliance. And it's my hope that by this now being a law or a director's order and a requirement here in Hamilton County, we see increased compliance. In addition to that, my team has created some literature, and we're sending it out to our businesses and our communities to help kind of spread the word. Believe it or not, even though this is probably being covered on every channel and everyone in Hamilton County is talking about this, there are always going to be individuals that don't know that it's a requirement. So once again, we're going to keep pounding the pavement and making sure people understand the new requirement, and we'll start to see greater compliance as we go with time.
And
Can I offer something anecdotally to that, John? So I hear you. You know, there are some individuals that simply don't want to wear masks. However, when you look at what's happening right now, when the governor, through his health director, mandates that we wear masks in certain counties, Hamilton County being one of them, you know, that is a serious measure. And I know there was a great deal of consideration given to that, and he consulted local officials, he consulted health experts and doctors, and we've had many conversations about this because it's a big step. The other piece, though, is that in this community, we have seen businesses especially step up, and P&G is leading the charge to make sure that we are communicating out to everyone. Everyone is hearing the message, to Greg's point, but also validating that we all need to be wearing masks as a matter of public health. And so when you have P&G and the Chamber of Commerce and others that people, I think, view as leaders in this community, saying the exact same thing as the health commissioner and a county commissioner and the city assistant, then you start to understand, oh, wait a minute, this is broadly accepted as the best thing for us to do right now. And so, I mean, personally, I'm hopeful that some of the campaigns that you have seen launch in Hamilton County will help change a little bit of that mindset and some of the culture in the community, where we are all on board here, because this is the way to keep people safe, as Greg has said many times, but also to keep businesses open and to make sure we can go to Oktoberfest. I mean, if that is even in the offing, and that's so soon, we think maybe not, or go to a Bengals game in the fall. I mean, are we going to be able to do any of this stuff? Well, not if we have a continued increase in our community. No, the answer is no. So we want the answer to be yes. That we can live with the COVID-19. We can do it because we're wearing masks and we're doing all the other things we know how to do. So to the naysayers or to the folks that don't want to do it, I say, well, then we should expect a delay in all of the things that we so enjoy in this community collectively, right? And I think the other piece is that some communities are hard to reach when it comes to communications. And so we are trying very hard to message into those communities, especially in the hotspots, to make sure that folks are aware of what they can do to tamp down the curve.
So those are all good points, and they lead to the second part of the question, which is, I'm wondering how close you think we might be to having the state say everybody's got to stay home again and only essential businesses, because you've said, Denise, we're trending in the wrong direction. You worry about hospitalizations going up. How close do you think we are to that point? I wonder what the threshold is, Greg.
Yeah, I cannot get into the governor's mind and try to anticipate what he might do, but this is a serious step. I will tell you that. There were a lot of conversations amongst many of the county commissioners throughout the state, because remember, this is a statewide issue, and the governor has been very careful about where the mandate exists. It's in certain counties that are trending in the wrong direction, the red counties, as we call them. So I will tell you, I know that he didn't take this lightly. We've all been on the phone with the governor. He's had many conversations with the health commissioners. So, and also, I think it's important to understand, because I've been asked this a million times, why can the city do something, but the county can't? Well, we don't have the authority to do this. The city does, because of the home rule. So we have to follow the lead of the state, and that is exactly what we're doing. So again, I'm supportive, and I know Greg is supportive of what the governor has said about mask wearing. We need to do all we can to keep people safe and try to keep businesses open, to preclude what, John, you're talking about, so that we don't get to a point where we've got another stay-at-home order.
Thank you.
This question comes from Jay Hanselman with WVXU News. He wrote in, the governor mentioned yesterday about COVID-19 spreading at family gatherings. Commissioner Dreihaus mentioned last week that cases happened at a baby shower and a surprise birthday party. Since the mandatory mask policy doesn't apply inside a person's home, does it miss the mark of preventing the virus spreading at family functions? Greg?
Generally speaking, the message that I've been sharing and Commissioner Dreihaus have been sharing weekly on Wednesdays has not changed. COVID-19 is here in our community. So we all want to let our guard down. We all want to come back together and spend time with our family and our friends. But each time we bring two families that have been separated back together, we increase the risk of COVID-19. So if you're doing those types of activities, there are creative ways to do them safely. I would recommend outside. I would recommend spacing and continuing to keep those a focus and a priority. we will never be in private lives regulating how people are getting together. And that is not the goal here. The goal here is to raise awareness so that we can keep Hamilton County safe.
Thank you. And a follow-up question that you mentioned during your comments, Greg, but if you could reiterate, some folks are waiting on test results coming back from going to a couple of the pop-up testing places. When can they expect to see or to hear back on those results?
So as I mentioned, at the conclusion of today, we will have tested 6,000 individuals here in Hamilton County at the Ohio National Guard pop-up testing sites. That number is phenomenal, and I really appreciate the support of our communities, the Guard, and my team who came together to make this happen. As a result of testing so many people, we are seeing some backlog from the laboratory and getting those results back. In addition, my team is now responsible for communicating out the negative test results as well as the positive results. So as soon as the lab sends those results to us, we are sharing those out via a phone call. If you see a phone call come from 946-7800, please answer it so that you can get your test results.
Mm-hmm.
Thank you. That concludes our questions from reporters.
All right. Well, thank you so much to everyone for jumping on. Thanks, as always, to Interim Health Commissioner Greg Kesterman for all of his expert advice and interpretation of what is happening, particularly as it relates to masks. So, we'll be back next week on Wednesday. I just want to remind everyone, and we've said it before, but I think it's worth repeating, this is up to all of us to do our part to make sure we're safe and trying to keep our community open for business. So the hashtag is #MasksOn. Jay, I don't know, you can't see me. Hashtags mask on. Let's do our part to keep our community safe. Thanks for jumping on. See you next week.